Good day, my name is Anita Mache Enabuma, PN semester student at George Brown College. I'm here to teach the skill of how to mix insulin. The main objective of teaching this skill is to prevent having to give the patient two separate injections to keep them in a therapeutic blood sugar level range. So before you mix your insulin, keep in mind that you should never mix a long-acting insulin with any other insulin, and usually the most common other to mix will be the NPH, which is the intermediate acting insulin, and the regular insulin. So you should administer the dose of the insulin 5 to 10 minutes after withdrawing, because the regular acting insulin binds with the NPH, and this reduces the action of the insulin. And also you should check the patient's blood sugar level, that's the glucose level, just to be sure they're not hypoglycemic. You should also do your regular assessment. If the patient is hypoglycemic, you should withhold administering this insulin and contact the physician. So before you start, you should check the MAR and provider's order for the type of insulin to be mixed, their peak duration, nursing implication, and all the information you need. And you should also you select the vials of insulin, cross-check them against the MARs, check they're not expired and they're not broken. But you also check the syringe that you're going to be using is still sealed and intact. So before I start, I will roll up both my insulin in my hands. Roll it. Do not shake, just roll it between your hands. Then I'll take my alcohol swab and wipe the top of each insulin. Before you start, you should always perform hand hygiene before you start any of this, before you start mixing your insulin. And then we mix insulin from clear to cloudy. So we draw up the clear before the cloudy. The intermediate acting insulin, which is the NPH insulin, is usually cloudy, as you can see. So today we'll be assuming that the other dose for the insulin will be, 20 units for intermediate and 10 units for the regular. So we'll start by drawing up the dosage for the intermediate, drawing up air, which is equal to the dosage for the intermediate acting insulin that will be administering, which in our case is 20 units. We will inject this air into the insulin, making sure that the needle does not touch the solution, and that we do not aspirate the medication. Then I'll draw up air equal to the dosage of the regular acting insulin. In our case, it's 10 units. And I'll inject this into the insulin also. And then I'll invert it and draw up 10 units of liquid. Making sure I have the accurate dose, I will eliminate all air bubbles. You can always withdraw more if after eliminating the bubbles you don't have the correct dose. Please make sure that you have the correct dose of insulin you are supposed to be administering. So at this point now, I'm supposed to calculate the total amount of dose for the insulin for when combined. So that's 10 for the regular and 20 for the intermediate acting insulin. Then I will look for the point on the syringe where both dose combined is supposed to reach. So 20 plus 10 will give me 30. So I'm gonna withdraw my long-acting insulin to reach the point of 30. I'll make sure that I do not inject any insulin already in my syringe into the vial. Also make sure to withdraw the correct dose. Because we're not supposed to push back. Correct. So I have 30 mils of insulin. Then I just cap my syringe. I'll verify all this dosage that along the way with the nurse, and then I'll make sure that it is administered within 5 to 10 minutes of withdrawal. I'll also label my medication, follow the other rights of medication administration. This video is solely just teaching how to mix insulin. So like I said, keep in mind that we mix from clear to cloudy, and that the main objective is to prevent having to give your patient 2 injections. Thank you for watching. I'll also be giving out a handout with the steps needed to follow to mix insulin. Thank you and have a good day.